Okay, now we're going to go over coronary circulation, which has nothing to do with systemic. This is its own little mini circulation. The heart is an organ, so it needs its own blood supply, and that's what we're doing. All right, so we start with the left coronary artery, which comes off of the aorta, runs behind the pulmonary trunk, and pokes out right here. Now the left coronary artery branches into the anterior interventricular artery. Now that's more commonly called the LAD, left anterior descending, or the widowmaker. The other branch coming off the left coronary is the circumflex, think circumference. This is going to wrap around to the posterior side of the heart. Then we can come to the right side and we will see the right coronary artery runs all the way down. Then our first branch here is the marginal artery, which runs on the margin of the heart. Then it's going to wrap around to the posterior side, where it is now going to run down the middle, and we call it the posterior interventricular artery. And again, this is the red one right here. All right, now if we go back to the front, we can do the veins. Okay, so remember, veins drain used blood from the heart muscle. All right, so we start with the great cardiac vein, and it's great because it's so long. It starts on the anterior surface of the heart, running parallel with the LAD. Then it comes up, wraps around, again running parallel, but this time with the circumflex artery. It wraps around to the posterior side, where it widens out and becomes the coronary sinus. Then we have the middle cardiac vein that runs parallel to the posterior interventricular artery. Now the middle cardiac vein is going to run up and dump into the coronary sinus. Now, once the coronary sinus is then going to dump into the right atrium. Now it's important to understand why we have to take the blood from the coronary sinus into the right atrium. Now, it's all venous blood. Venous blood is low oxygenated, so we would not want to return that blood to systemic circulation, because wherever that blood went to, those areas would not get oxygen, because we already used the oxygen in it. So we want to return that blood to the right atrium so that we can send it back through the heart and then back to the lungs to pick up oxygen again. Okay.